Hello, everybody. Meet Dr. Drew Chase, if you have not met Dr. Drew Chase before. He's my expert contributor in the orthodontic world in Westwood Living. You've seen his articles. They're very useful. So I appreciate, number one, your support. So thanks very much.
Thank you.
I also appreciate you hosting me here to talk about something that is important to you and important to a lot of us, including me. And I'm going to plead ignorance because I'm confused about how I should be thinking about this question too, which affects your life so much.
Well, thank you. And it affects my life, but more than my life, it affects your life. The reason this question affects your life is because it has to do with dental insurance and what coverages you have as an individual who has dental insurance. Currently, there is no what we call medical loss ratio, and that is the percentage of premium dollars that is spent on your care in dental. In medical insurance, this does exist since Obamacare was enacted years ago. And in Massachusetts, the insurance companies run at an 88% MLR, medical loss ratio.
For medical?
For medical.
Okay.
Which means 88% of the premium dollars that are spent on your medical insurance must go to patient care. And if they don't, they have to get reimbursed to the premium holders. So the medical insurance companies are held to a standard to ensure patient care is their number one priority. Dental doesn't exist that way.
So let me play a little bit of devil's advocate and just ask questions that I don't know the answers to. So I hear this and I'm like, well, do dentists just want to make more money?
No, this is not about dentists wanting to make more money. They probably will make more money, but it's not a function of this as it looks on paper. The reason dentists would make more money is because there's going to be more money in the patient's pocket for care. So when you go to a dentist or a periodontist to get gum surgery or an oral surgeon to get wisdom teeth extracted or root canals at an endodontist, you're presented with a fee. And you know your dental insurance will cover, say, 80% of that up to $1,500.
Right.
Now,
then it's capped.
It's capped.
Got it.
Now, the insurance companies are spending roughly 60 to 70%, and this is data that we know from their filing with the IRS, on patient care.
And you want that to be up to 83. That's what this bill's about.
There's about a minimum at 83. It's a threshold that we know that they can tolerate without hurting them, and it will allow us to capture data to ensure that we get to the correct level, which we believe somewhere is between 88 to 92%.
So you'll make more money, yes, but you won't make more money because you're getting it from the insurance companies per se. You'll make more money because I'll go to the dentist or I'll go to the orthodontist.
Exactly.
Because I can afford it.
Exactly. Because instead of you having to pay $1,500 for your crown, you might have to pay only $1,000 for your crown or $800 for your crown.
Got it.
Or they can lower your premiums, or they can pay more for your care.
All right, well, there's a little bit of clarity. Obviously, he works in the field, so he looks at it from one perspective. So when you go into the ballot box, you are voting?
Yes, on question 2, so your dental insurance works for you.
And at least now you have a bit more information. No matter what side of the issue you're on, at least you now understand where he's coming from, where other doctors are coming from, and how it could help patients like me who probably haven't gotten as much dental care as I should have gotten over the last few years because it is so darn expensive. So thanks a lot.
Thank you so much.
Thanks for the clarity.
Your time.
Yeah,
My
it's
pleasure.
good just to have smarter people talk to you every once in a while. It's a smart idea.